Classical music used in music therapy. The presentation will be talk about the music and composer, music elements, the background and elements of the music that I chose, how to use this part of music in music therapy, and the conclusion. There's an article from the American Music Therapy Association, written by Diane Gregory. It is said that therapists use the music responses to practice extra music objectives, such as recall, memory, social interaction, alertness, and sensory stimulation. These goals are usually for aged care in music therapy. Music and composer. The music I chose is from Giottino on American National Songs for flute and violin with piano, Op. 37. The composer was Franz Doppler. He was born in Austria from 1821 to 1883. He was a flute virtuoso and composer, and famous for his flute music. His representative work was to rearrange Hungarian pastoral fantasy composed by Franz Liszt. Also, Franz Doppler was a musician in Romanticism ages. The music elements of Giottino on American National Songs. The instruments played in this music are flute and violin, or there's the other version for two flutes with piano. There are four famous American songs in this music: Hail Columbia, American National Anthem, Boatman Dance, and Yankee Doodle. Doppler used the themes from these songs and rearranged some part of them, making conversations between flute and violin. The background of Yankee Doodle. Yankee Doodle is a well-known Anglo-American song, and the origin was back to 7 Years' War. Some parts of melodies and lyrics were popular in England before American Revolution. The British Army used this song to ridicule the colonies. The meaning of original lyrics was teasing the dressing and behavior of the colonies. However, American Army used this song to show that they were proud of their manner and truly personalities. This song is also the state anthem of Connecticut now, and is one of the favorite children's songs. The music elements of Yankee Doodle. In this part of music, there are one theme and one variation. Doppler made a conversation between flute and violin. The violin goes the first part of theme melody for once, and then the flute follows it with the same melody. But the violin has short response when the flute playing the theme melody. After, the violin plays the second part of theme melody, and the flute and violin do the same thing again, like a conversation. Here's the theme example from this music for the theme part. For the variation part, the flute and violin play together, but with different melodies. When the flute plays the theme melody, the violin will play the other melody to accompany, and they change the roles again. Here's the music of variation part. How to use this music in music therapy. The population that I will use this music for is the aged care people, especially for the person who has the background from Europe or America. My aim is to maintain their attention, to recall their memory, to make them have joyous and bright in the daily life, and to increase their social interaction to a variety of settings. For the music activities, because this music is easy to learn and rhythmic, it can be used for listening, singing, and doing some simple movements, such as clapping, stamping, and dancing. And for the variation part, the client can play some instruments or hand percussion with the rhythm. Conclusion. Many studies show that classical music have the positive impact to the patients, such as stroke, hypertensive elder, and cognitive impairment adult. They found classical music helps the patients improve their visual attention, control their blood pressure, and maintain their attention. However, classical music can be used for anyone, not only for aged care, but also for children and adults. Here are the references. Thank you for your listening. If you have any question, please feel free to comment and discuss with me.